Friends and viewers, welcome to another exciting episode of Presidential Talk. I'm your host, Juan Mendieta, where once again we take this show outside of the studio and we report on location to the campuses and the facilities of Miami-Dade College that are making the news and providing important services to the community. Today we are at the medical campus of Miami-Dade College in the heart of the hospital district of Miami, a very, very important campus in the operations of Miami-Dade College and also in the community. We're joined by its president, Dr. Armando Ferrer, and also the dean of the school of the Benjamin Leon School of Nursing, Dr. Amy Pettigrew. Welcome both to the show. It's great to be at your place.
It's a
pleasure to have you here. It's really an incredible facility, and really we're right in the middle of the hospital district of Miami. One of the really great things about this campus is that amongst all of our programs, probably around 40% of the healthcare workers in Dade County have graduated from Miami-Dade College Medical Campus.
And for viewers who perhaps haven't visited here before, and we've done this on previous shows, if you could do a quick overview of the campus, how many students you serve annually, maybe a recap of some of the special programs you offer here.
Absolutely. We have the largest school of nursing in the United States here. It's the Benjamin Leon School of Nursing. Dr. Pettigrew is the dean of that particular school. We also have the School of Health Sciences. Altogether, we have about 22 different programs that range from certificate programs such as phlebotomy, farm tech, and those kinds of things. Our social and science degrees, respiratory, such as this lab is for the respiratory technology program. We have a variety of other areas that we cover, and we also have a couple of bachelor's degrees, one of them being in physician assistant, and the other one is the RN to BSN program, which is one of the fastest growing areas in the United States right now and here in this campus as well.
And Dr. Pettigrew, I know you have an intimate understanding of that RN to BSN program here at the college. Tell us a little bit about that, because it's a true gem.
Okay, we're very thrilled to have this program. It's been in existence since 2008 here on the medical campus. We currently have somewhere in the neighborhood of 580 students from probably every healthcare facility in Miami-Dade County in our program. We currently have relationships with direct entry for RNs from 15 different hospitals in the area, and every day we're expanding our coverage and relationships with hospitals to offer education for more and more of the registered nurses. The RN-BSN program was designed for people who are already registered nurses and have met the prerequisite requirements. They then can come into our RN-BSN program and, ranging from 3 to 5 semesters later, have their baccalaureate degree in nursing.
And one of the really neat things about this program is that you really have 3 different options. One of them is obviously face-to-face, a little bit more the traditional format. Additionally, we have the blended model, which is basically a virtual college and a face-to-face. And then we also have the virtual college component of it. Now, there are still a couple classes that they have to be here on the campus and also work within the community, which is part of the leadership portion of that program. But it's really kind of exciting to see that individuals have a variety of different options that they could go after.
And Dr. Ferrer, Dr. Pettigrew was talking about the different facilities from which our students come from, and you've often talked about the reach of this campus as well. And you typically, anywhere you go that's a medical facility, you always ask who has graduated or attended the medical campus, and what are the responses you get?
You know, one of the interesting things, and sort of to answer your question in a roundabout manner, is that my aunt, who's now 88 years old, fell down the other day, and I had to take her over to emergency at South Miami Hospital. Of the 5 individuals that we dealt with, 3 were our graduates, which really made me feel really good, because I know that the quality of service that she's receiving is just exemplary. But we have, at this campus, we have 820 clinical sites. And by clinical sites, what I mean, all of our programs have a theoretical component and a practical component. The practical component is the one that deals with the clinical sites. So we're at every major hospital and also smaller chain hospitals as well. But not only there, we're at doctors' offices, we're at outpatient centers. In our vet tech program, obviously we're in a number of veterinarian offices, services for the county. So really, there aren't very many places in Dade County where you're not going to run into some of our students in one fashion or another, either as graduates or as they're going through their clinical rotations.
And I know a lot of people seek our students out and only like to be attended to by Miami-Dade
Right.
College students. And Dr. Pettigrew, tell me about the strong emphasis on safety and quality here.
Well, within our program, the RN-BSN program, we have a very strong emphasis on quality and safety in order to provide the health care that we need to for the 21st century. Our hospitals and healthcare facilities are increasingly complex. The patients coming in are much sicker. The chronic illness management is much more difficult. And our students learn evidence-based practice and how to provide state-of-the-art nursing care in order to keep people healthy longer and in order for people to be cared for in a very safe and high-quality environment in the hospitals. A good index of what people think about our program is that 100% of our RN-BSN graduates are employed at graduation. Many of them, as soon as they start the RN-BSN program here at Miami-Dade, are hired at many of the institutions in Miami. So with a 100% placement rate and our employers telling us the very high quality of our students, we're very pleased that we can offer this program for our community.
So Dr. Ferrer, with a mantra here at this campus that says connecting the knowing with the doing, our students, our graduates are definitely workforce ready when they finish here. And they also are entering jobs that are very high quality jobs with great salaries.
You know, one of the fascinating things about this campus is that obviously Miami-Dade College as a whole changes people's lives. This campus absolutely changes people's lives because when they graduate from us, they're ready for employment. As you're aware of, our campus basically only offers our programs, the medically related programs. The students receive their prerequisites and general education courses at our other campuses, and then they apply to our programs here. You know, our reputation in the community is that our graduates hit the ground running. I don't want to mention any hospitals, but one of the hospital chains about 2 or 3 years ago, they were hiring 33 nurses. 30 of the ones they hired were ours, who then later on their CEO came to them and said, we have a school here too. And they said, yes, but theirs hit the ground running. And basically the comment was, and so will you next time if you don't hire more of ours.
That's a great point to finish this first segment. We're actually out of time already. We're going to be back to continue talking about the important medical campus at Miami-Dade College and the exciting offerings and, more importantly, the great things that this campus is doing in the community. You don't want to miss it. Stick around.
Be creative. Be a hero. Be the solution. Be connected. Be innovative. Be global. Be successful. Be you. Be MDC. Be Miami-Dade College.
Welcome back, dear friends, to another exciting episode of Presidential Talk, where today we are broadcasting from the medical campus of Miami-Dade College at its respiratory lab. And on this second segment, we're also joined by the Dean of the School of Health Sciences, Dr. Mark Everett, who's joining Dr. Ferrer, the president of the campus. Dr. Everett, thanks for joining us.
Absolutely. Thanks for being here.
Now, you have an important purview here at this campus. I'd like to talk to you about the programs that you oversee here, if you could.
Most certainly. This campus is just so unique to this city of Miami, and in particular to Miami-Dade College. We have over 22 programs here at the campus that range from short-term certificate programs to AS degrees to even a baccalaureate in health sciences with a physician assistant option. That program alone is just by far one of our most fantastic programs. It is allowing students that have completed the AS degree in physician assistant studies, and it allows them to complete within about a year to a year and a half additional credits that are concentrated on management, leadership, research. So it really prepares our students well.
And in physician assistant studies, the quality of our students is astounding. I know that they do very well in statewide and national competitions because physician assistants step in for the doctor, and their role in today's paradigm has definitely increased.
Oh, absolutely. The physician assistant studies program, by far world class, taught at a master's level. They are our next providers. So when you hear of the city or the county being short of providers, they will become our next providers, and they are. They're serving under physicians and are actually providing health care for the public.
And actually, what's interesting is that a couple of my physicians have actually hired some of our physician assistants. So the last couple of times I've been in the offices, it's really been like being back on the campus because I'm seeing our own students that I dealt with here on the campus. Now I'm seeing at a professional level, and they're the ones that are now providing me care.
And Dr. Ever, you mentioned something important a few minutes ago. You were talking about the coursework here for the PA program being really at the graduate level. And that reminds me that when our PA students travel for statewide or national competitions, they're not competing against baccalaureate students, but in most cases against grad students or higher.
Yes, in fact, we have won the Brain Bowl. It's a national competition against Harvard and Yale and other Ivy League schools, and very proud to report that we have placed second in the past, and about 2 years ago we actually won the National Brain Bowl competition.
I know that at one of our board meetings, Dr. Ferreira, they posed some of the questions to the audience and the board members, and certainly the level of capacity and quality of these students is really unsurpassed.
You know, I sit on a couple of boards at some of our local hospitals, and I'm also part of one of the MECs, which is the Medical Executive Committee at one of our hospital groups here. And one of the things that I get requests from them almost every couple of months is they'll ask me if we've got a couple of good physician assistants. Of course, my answer always is, which is absolutely true, is that they're all exemplary. But this is a profession where you're getting individuals that are being offered job salaries that range anywhere from $85,000 to $95,000, and they're being hired even before they graduate from the institution. So really, it's an incredible program.
It speaks volumes of the institution and probably the faculty as well here. And I want to talk about a new program as well. There's a new part-time program in opticianry here as well. Mm-hmm. Tell us about that, Dr. Ferrer.
The opticianry program is, we have had it for a number of years, and this is a program where 100% of our graduates are hired. We've got a close to 100% passing rate on the licensing exams. So the program is really a great program, but now we're going to take a slightly different track on that, and I'll let Dr. Everett talk about the new part-time program that we're going to have in opticianry program.
Sure. This is a fantastic program, as well as many of our programs. And within the opticianry program, our students are exposed to contact lenses, they're exposed to framing options, they're exposed to really providing a patient exam for the patient. And they can go into their own practice, their own private practice after graduation. This part-time track is in response to what the public needs and what they're demanding. We have a lot of individuals that work part-time or full-time. In fact, 70% of our population today at the medical campus are on part-time track. So this complements our effort now at the campus and provides a unique opportunity for individuals that work full-time and want to receive a degree in opticianry technology.
You know, one of the interesting things about this program is that many of these, or some of these shops are family-owned. And we actually have had a student this past year that was third generation in the same business in the family. And the interesting thing is that after she graduated from the program, taking some of the knowledge that she gained in the program and some of the approach to dealing with customers, she has increased her average sale by about 30%.
And we're going to, I'm sorry, continue.
I was going to say another unique aspect of our operation is that we actually have a clinic within Miami-Dade College Medical Campus where patients can come in, receive a complete eye exam for $20, and it's our students that are performing the services.
That's actually exactly what I was going to say, and I was in a meeting with you last week when you were chatting me a little bit about going elsewhere and not taking care of that eye exam right here at this campus.
Well, I would tell you, one of the really fascinating things, once again, about this campus is that we have actually 3 clinics. One of them is a dental hygiene clinic, the other one's a vision clinic, and also a health and wellness clinic. But when I first came to the campus, I needed a pair of glasses, so I make sure that I went to utilize those services. And really, I have 3 pair of glasses now that I have, after getting my eye exam, I have purchased through our clinic. And we charge $20 for the exam. And then there'll be our own person, our own professional that will see the patient as well and make a prescription for lenses. We usually charge about 10 to 20% above cost because really it's a learning environment that we have here to give our students the experience and also provide a service to the community.
Well, lesson learned. I'll be here next time because I don't think what I paid was anywhere close to what you offer here. You know, we got about 3 minutes left in this segment, but I do want to drill down through a few more important programs. Health information technology, extremely important today. Dr. Everett, tell us about that program.
More than ever before because of the Affordable Care Act and the mandate to actually implement electronic health records and electronic medical records into private practices as well as big, large hospital systems. So we actually have 3 different tracks involving health information technology. That's our Health Informatics Specialist program, which is a short-term program. We have a Coder Biller program, which is also a short-term program. And when I say short-term, we're talking 2 semesters plus or minus. And both of those allow the students to receive credits into the AS program for health information technology. Those individuals are graduating practically 100% placement for those particular students. So the demand is overwhelming in some respects.
You mentioned something very important. So they're stackable courses, stackable programs,
Yes.
so that you can continue your studies if you wish once you get the certification.
Absolutely, and it's a wonderful opportunity for our students. So whether they take a part-time track or a full-time track, there are certain completion points along the way that actually allow them to be employed immediately.
Dr. Ferrer, you were going to add something to that?
No, it's just that is really one of the things that we try to do with many of our programs. It not only allows them to go in the same progression within field, but very often we'll also allow them to go in a progression into some of the other fields and some of the other programs that we offer. We have an accelerated program in nursing that if the student has completed a certain number of our courses and some of our other programs, it allows them to go into nursing and really expedite that process to allow them to complete the program a little bit sooner than they would if they were just coming without some of those courses.
Well, thank you very much. And viewers, you heard it, lots of options at this campus. We're out of time on this segment, but we're going to be back again to talk a little bit more about the medical campus, and we're going to talk about a very important event that this campus does every year. So stick around.
Be creative. Be a hero. Be the solution. Be connected. Be innovative. Be global. Be successful. Be you. Be MDC. Be Miami-Dade College.
Welcome to this final exciting segment of Presidential Talk at the medical campus of Miami-Dade College in the respiratory lab, where again we're joined on this segment by Dr. Ferrer, the president of the campus, and also Dr. Mark Everett, the Dean of Health Sciences here at this campus. One of the things we touched upon in the earlier segments was the annual community health fair that you all do, which this year, or this coming year, is going to be February 27th. And for many people in the community, it is really their only brush with healthcare, with preventive healthcare. Tell us about that and the programs offered.
Absolutely. So this year's health fair is going to be on February 27th from 9 to 1 o'clock here at the medical campus. But this is an opportunity for patients that do not have access to any services, and certainly those with access. They can come to one central location, receive services, receive screening services for so many different ailments that they may have. And more importantly, be educated about their health care and in ways to improve upon their health care. So this sometimes is the only health care that these individuals receive. Last year we served an estimate of about 1,600 individuals coming through these doors and provided some great services, including for children as well.
Dr. Ferrer, that has to be a tremendous source of pride for the team here at this campus to provide that service while gaining experience too.
Yeah, this is really the signature event for this campus, and one of the things that we have been able to do through the great work of the campus and Dr. Everett is really expand the services that we're providing, expand the number of different community agencies, educational institutions, and other partners that come and join with us on that day so we can provide a wide variety of services really across the board. Additionally, we've been able to get our hospital partners also to come in and provide services. One of the services that we provide is mammograms. And we have really grown the number consistently throughout the years. And what we do is we approach it one of two ways. One of them is the individual can call in for an appointment, and we have a limited set of those. But we also will have a number of mammograms available on that day. Now, what has happened in the past 3 to 4 years is that individuals start lining up at 6:30 in the morning to get those services because these are free services. On that day, all the services we're providing to the community are for free, including our dental hygiene services, where we do teeth cleaning and other minor types of work in individuals. And you know, the really exciting thing about that is that we have our own graduates that are coming back to provide those services.
I didn't realize that, so it's current students and former students as well.
Yeah, in fact, in the dental hygiene clinic that Dr. Ferrer just mentioned, we can serve at any one given time about 49 patients at one time. So normally we'll do between 2 and 3 shifts of patients, and we couldn't do that without volunteers. So a lot of our alumnus come back and provide those services with us. So last year I think we had somewhere around 70 volunteers just in dental hygiene alone. And that dental hygiene clinic is one of the largest across Florida, if not the United States.
And some of the other screenings and services, glucose, blood pressure, cholesterol, HIV as well?
Yes, all of those included and then some. So even considering osteoporosis, we do some bone scans as well. So the services are by far just so important for our community, and we couldn't do that without our partners. As mentioned before, we had over 50 other healthcare agencies participating with us during this health fair. And as far as sponsors, ranging from Connect Familias and Aetna and Humana and so many other players that help fund the project. So it's a great community effort and serves our community quite well.
And beyond the services, also a wealth of information that you provide to the participants that day too?
Yes, absolutely. So through the 50 plus community agencies, you can obtain information on all types of healthcare related matters, including nutrition, including pets as well. We have a veterinary technology program, as mentioned previously, so we actually provide information related to pet care. HIV as well. We have various associations like the Haitian American Nursing Association that always comes in full force to provide so many wonderful opportunities for our community.
You know, one of the things that's always one of the most utilized services we provide is our massage therapy program. They will provide free massages on that day. And as you can probably imagine, there are some lines to utilize their services.
We need to have those extend college-wide, especially on those stressful days. I'm going to see what I can do about that.
I certainly would appreciate that. But, you know, one of the interesting things is that we do, our students do go out into the community very often, working with our community partners, particularly massage therapy that does do some massage therapies right on site for some of those programs. Because part of their program, once again, the theoretical and the practical, is that the students will be providing a certain number of massages before we can say that they're competent and allow them to sit for their certification exams and licensing.
And finally, on the health fair, the Children's Corner, I heard that that's a very important component as well.
It's very important to get children off on the right foot. So we do a lot of education with children. We have a lot of fun with children as well, from the physical activity standpoint, how to wash hands appropriately, how to brush their teeth. So it's a wonderful, wonderful day. So that comes with a bounce house as well as snow cones, face painting and balloons, etc. So it's a great children's corner.
And I saw those students in action at the book fair as well, which is always very nice to see the students getting out into the community.
You know, one of the most interesting things about mentioned in the book fair is that many of the parents who were there said that that was really the most enjoyable booth for their children, and one of the ones that they really appreciated because those services were being offered to the children.
So gentlemen, if people can't make it that day and they want to come out for a general health screening or checkup,
Yes.
what should they do?
Well, there's a couple things. So here at this particular campus, as we mentioned, we have our 3 clinics that operate on a regular basis, Monday through Friday. They can certainly call in and make an appointment or just stop in. Walk-ins are welcome. So that includes our vision clinic, our dental hygiene clinic, and now we have a primary care clinic. So one of the important elements of the health fair is to connect individuals to health care. So we want to make sure they have a medical home. We have a medical home here at the campus.
And one of the things that also when I first got to the campus, it had been a little while since I'd had my teeth cleaned. and I went and utilized the services. And what I can tell you is that they went places where no other human being had ever been before, including me, and it was just such an incredible job that they did. It takes a little bit longer, but the type of attention, the type of service that you received is really unmatched.
Gentlemen, any estimate between the health fair, between the clinical rotations, the clinics, the outgoing missions, how many people you treat and care for on an annual basis? Have you ever thought about that?
One of the other things that we mention is our signature event on this campus is the health fair, but also throughout the year we'll do an additional 30 to 35 other health fairs throughout the community at different levels of services. Some are educational, some are full health fairs. So we provide those services, and also all of our programs have a community services component. So the students have to do their clinical rotations as part of their program, but we also require all of them to do community service, and that's about 30,000 hours of community service a year that our students provide. At the dental hygiene clinic alone is over 2,000 students, vision clinic over 900, and in our wellness and service clinic probably another 2,000 plus or minus.
And students also have the opportunity to travel abroad here. We've certainly done some outgoing health mission work in the Caribbean. Tell us about that.
Well, we have various immersion trips, as we call them, experiences for students to partake in efforts related to healthcare in remote regions, and that includes Haiti and Dominican Republic and also Jamaica as well. So we partner with various agencies across these other areas and provide much needed services. In fact, our recent trip to Jamaica was very successful, came back here, and the students were able to actually manufacture the glasses that we then later sent back, and that was in excess of 150 pairs of glasses that were done.
One of the most interesting things about that trip was really a comment that a young man made to one of our technicians or one of our students, and after she had worked with him, his comment to her was, "This is what it's like to see." I mean, when you get those kinds of experiences, I mean, it's just very moving, and also it changes people's lives, you know. We also not only do medical missions outside of the U.S., but we also have our students go to the Immokalee, Everglades, Okeechobee Lake area, where we also do similar type of work there.
Lots of work with the migrant community there.
Exactly right.
So gentlemen, we are out of time. I know that we could do several programs likely on this campus because again, it's such a gem, and while there is a level of awareness for this campus, there's still some folks who don't know about it. So it's important for people to check out the medical campus at Miami-Dade College, not only for educational needs, but also for the health services that it provides. So that's all the time we have. Gentlemen, thank you very much. Thank you to our viewers for spending the last half hour with us. And we'll see you the next time right here on MDC-TV on Presidential Talk. Good day.